Hi, everyone. This is Laura Williamson. Welcome to Bear Speak. It is wonderful to have you here today. Before we get started, I just want to let you know we have another fabulous show. We have Nancy Burzak with us today from Balanced Wellness. Welcome, Nancy.
Thank you, Laura.
And before we get all into the throw of everything that we're going to be discussing today, let me tell you who I am. I am a personal trainer, a Pilates instructor, a health coach, and I happen to be a Reiki practitioner. So I train from the inside out, and I am here for you. And today's fabulous topic is about menopause. This has been a topic that many people have been asking me to do. So here I am per your request. Nancy is here today to answer as many questions as she can about menopause, what it is, why it is, all the things. So, Nancy, now it's all about you. Tell us everything. How'd you get here? Welcome. Tell us about the business, all the
Thank
things,
you,
because we're
Laura.
excited. We've been waiting for you.
Awesome.
Just
Thank
so you know.
Laura. So we have a functional medicine practice that specializes in hormone health for women, especially menopause, also weight loss, and we also do general functional medicine consults in general.
Okay. All right. Now, how did you get started?
So basically, about 7 years ago, I had a head injury.
Mm-hmm.
I've been a traditionally trained nurse practitioner for many years, and I had a head injury that left me with vestibular migraines. So
Okay.
vestibular migraines are basically migraines without the headache. So you get everything else. So you get the dizziness, the nausea, the lightheadedness, the sensitivity to light, sensitivity to sound, all the stuff without the headache.
Okay.
I was fairly disabled from that. I was out of work for 6 months, and even when I went back, I could only go back a few hours a day because everything bothered me. I was suddenly a sensitive flower.
Okay.
So the overhead lights bothered me. The screen bothered me. I would walk down the hallway with the zigzag rug and bounce into the walls. I would look in people's ears with the otoscope and fall into the wall. It was horrible. So I could only work a few hours a day because by the end of that, I was toast and my brain was not working.
Okay.
And I had severe brain fog and word finding difficulty, all of this stuff. So I had been seeing many different traditional doctors, saw neurologists, saw ear, nose, and throat doctors, been on many different medicines. With every medicine, I thought, this is going to be it. This is going to be the thing that's going to fix me. And it didn't. I had many CAT scans, MRIs, the whole shebang. At the same time, my office mate at the time was going through her family member had Lyme disease, which is another sort of invisible illness that people really don't know what to do with.
Right.
So here we were, two experienced nurse practitioners not knowing how to even deal with ourselves and our family members. And so when we healed ourselves and her family member via functional medicine with a very holistic approach, we got to the other side of this. We thought, okay, we need to learn more about this, go for certification so we can have this care more accessible to other people.
Okay. What was the certification?
So we did IFM, so the Institute of Functional Medicine certification course. So yeah, it took a few years, learned a lot, but it's been very rewarding.
Okay. So there are two of you. You have a partner.
I have a partner too. Yeah.
Okay. So the two of you together in your own, well, what do we call it? Is it considered medicine? Do you take insurance? Like, it's functional medicine. It sounds like it's a little bit of everything.
It's everything. So functional medicine is very comprehensive. It's looking at the whole body as a system rather
Okay.
than looking at each system individually.
Okay.
So in my specific scenario, my brain injury triggered some gut imbalances and hormone imbalances that gave me the vestibular migraines.
Okay.
So it makes sense that neurologists never picked up on that. You know, medications never worked because I wasn't going deeper into the root cause. So it's very rewarding when we go deeper and don't just slap a medication on people.
So you used the word deeper. You didn't go deep enough. You needed to go deeper. But how would you have known to go deeper? You understand what? Because there are many people. There used to be a way of thinking, and I think about my mom when I think about this, is what your doctor says is right. What you think. No, the doctor's never wrong. Listen to your doctor, leave it alone, and that's it. So there are people out there in my mind who are probably sitting out there right now who will think, well, the doctor said A, B, and C, and I remember this because I had an argument with my mom once, and then would have left it at that, and that's it, end of story. But you took it a step further. Why do that? Why did you even do that?
Because I was disabled, and I knew that was not going to be my end game. I would not let it be my end game.
Okay.
Even though I didn't fully understand what was going on, I became part of Facebook groups that were actually frankly depressing. Some people were talking about their emotional support dog that they needed with vestibular migraines, or how do I get my handicap placard? I thought, this is not going to be my future. So I did everything in my power to heal myself, but it took years.
It took years.
Yeah.
So what is your approach when you're working with people or someone comes in to see you? How does a day start for you?
Yeah, so we do very in-depth, we have patients do very in-depth intake forms, and we learn all about everything that has happened to them leading up to their current health concern.
Okay.
We look at all of the symptoms. So even if, for instance, they're coming to me for menopausal symptoms, we'll still talk about their gut health, we'll talk about their skin. They do a whole symptom review, which is every body system. And then we do very in-depth blood work. We look at their nutrients. We look at their hormones. We look at inflammatory markers, cortisol, their thyroid, all of these things, because hormones don't actually live in a bubble. Everything affects each other. Your gut affects it. Your cortisol affects it. Your thyroid affects it. So it's important to look at all of these things. So that's basically what we do. And then we come up with a plan, whether it's, there's always a component of lifestyle. There's, we help coach people through supplements. And then even when it gets time to, if someone is a good candidate for hormones, we'll even prescribe hormones at that time too.
So who's your typical client?
So we see everything. Some menopausal women who would like a more holistic view. We see some people, I have a fair amount of migraine and post-concussive patients now because of my story, and now I actually have tools to help people, which is very powerful.
Right.
We see some people who just want a wellness and longevity plan. All right, I want to age the best way I can. Help me with my lifestyle. What supplements should I take? Should I be taking hormones? Should I not? So we kind of help put all those pieces together.
I think as I'm listening to you, I think to myself, I think, well, what would be the circumstances for someone to come to you who has or wants a holistic point of view? Am I already living a holistic life? Do I have a holistic point of view before I get to you? Or am I at a point where I've tried everything and now, again, this is not my end game. Like, there's no way this is going to be me. How many of the people that you're seeing, like, not how many, but how often, what happens when? How often do you find, well, someone really came in with a holistic point of view versus, because where I'm sitting, I always think in terms of inside out, the entire person. That's what holistic means for me, right? So in my mind, I would think, I don't want to take a whole bunch of medication. I've been down that road myself. I don't want to take all the stuff. If I can avoid that, I really would like to. I'm gonna go here anyway. But you already also have the medical background. So for me, I would think automatically, well, this is a nice combination because I get the best of both worlds. I get someone who comes from this point of view and has experience over here, but they also have experience over here. So they can they can kind of streamline it and bring it all together and say, you know what, I know about this, but we also have that, and here's the effects that could happen if you do this over here, but then there's also that. So for me, that's a win-win.
Absolutely. So
without having to go, does it need to be holistic, right? I would have both. It feels like I would have both you're functional medicine, but it feels like I would have both options with you. Am I wrong in thinking that?
No, you're absolutely right. So we do everything from talking to people about stress management to optimizing sleep to even sending medications to your pharmacy. So,
Okay.
and everything in between.
Okay.
So
yes.
it's very interesting and it's very gratifying because I remember being in primary care, I would see so many women, like perimenopausal women that would come in with brain fog, fatigue, just not feeling themselves, even though nothing has changed. Their diet hasn't changed, their exercise hasn't changed, their stress hasn't changed, although they feel like they're less resilient to stress. And back in that setting, we would do very cursory blood work. And I would say, everything looks normal. You have to eat less and exercise more and do yoga or, and it was so not satisfying because I know the patient didn't feel validated, right?
Right.
And they're already working hard at what they're doing. And I felt like so it wasn't great for them. It wasn't great for me because I felt like I wasn't helping them, But now fast forward doing functional medicine, we can see that there's, we do the deep dive of the blood work. So we notice, yes, your hormones are out of whack. Yes, you have nutrient insufficiencies. Yes, your thyroid isn't as active as it should be. Yes, your cortisol is a little wonky. All of these things can contribute to the way you feel. So, which is satisfying because patients get answers. We have tools to help people with all of that. So it's just, it's interesting how the same person can have completely different approaches, and it is a game changer for their care.
So it's been my experience, because I've been doing this for around 22 years or somewhere in that neighborhood. So I feel like I've kind of grown and aged with a lot of my clients, and am going through a lot of the symptoms that you're speaking of, right?
Yeah.
And so the conversations that I have with people, no two women are the same. That's the other thing that I have noticed. But I'm also noticing that, and I probably shouldn't use the word textbook, but I feel like no two women have necessarily been textbook when it comes to menopause, right? And I give you an example. I have a friend, for example, who ended up having severe anxiety out of the blue, and she had no idea what, and similar to what you just talked about, she went to go get help. She went to do some things. She went to different people before she finally landed on one person who said to her, listen, this doesn't get talked about, and because the number is so small, there's a very strong possibility this has something to do with you going through menopause. Doesn't make sense, but is a very strong possibility. More time went on and things, and she recommended changing some things around. Long and the short of it was part of what she was going through. And she's like, I was having all these mental health issues, and I couldn't figure out what was going on, but I was ashamed to talk about it. See, now we got shame coming up. So then people will stay quiet and stay in their own corner of the world and don't talk about it because, like you said, she didn't feel validated. She just thought she was making up things.
Right.
And she really was not. And in the list, I could go through a list of different symptoms with different people and so on and so forth. But again, one of the reasons why I wanted you here was for that very reasons. There's also the weight loss side of things, and going in, I had one person mention to me there was some fat shaming going on, and I could keep going. I could keep going. But again, you're here now, and so I'm taking full advantage of the fact that you visited us today, and I am grateful. So what I will ask you next is, where did this passion come from? Why is this so important to you?
Yeah. So great question. We, as I said, functional medicine is looking at the root cause. And what we learned with working with patients is many times around this time in midlife is when things go awry. Autoimmune issues come in. People's cholesterol goes up. Their blood pressure goes up. Their blood sugar goes up. They become insulin resistant. So many things happen around this time, and the root cause of many of those problems is estrogen deprivation, right? So when you balance and you give people estrogen during that time, a lot of times you can prevent issues going forward, cardiovascular disease, all of that. Bone disease, you start losing bone very quickly. Like even in our 30s, we can lose bone. So it's important to do everything we can to maintain our health. And, I think hormones are a big part of that. So,
What would you say are some of the biggest concerns you've encountered with your clients?
I think,
Take your time.
No, that's okay. I think similar to what we said, a lot of people don't really feel heard. The symptoms are all over the map. They can have anything. Usually in perimenopause, people feel, like I said, just kind of not themselves, gaining a little weight around the middle, maybe increasing anxiety. And then as things go on, then they get the more traditional things like the hot flashes, the night sweats, the insomnia, all of that kind of stuff comes later. So those are a lot of things that we see. But like I said, we also see patients who have seen many providers for different symptoms and aren't really sure where to go. So they want the holistic view.
Okay.
Yeah.
So let me ask the number one question. What is menopause?
Yeah. So menopause is basically, you're considered menopausal when you're without a period for 1 year.
Okay.
It's the natural decline in estrogen, progesterone, and sometimes testosterone. Usually the average age is 51, but it can happen between 45 and 55. I have a slide here we can talk about. So between 35 and 45, if you look at this slide, you can see the red line indicates someone's estrogen level. And at 35, it becomes pretty erratic, right? It goes up, down, all around. So that estrogen fluctuation is responsible for irregular periods, for night sweats, for hot flashes, for loss of libido, brain fog, all of that. And then you can see after menopause, it kind of levels out, but at a low level. But you can also see during postmenopause, that's when diseases come up, right? Osteoporosis, more urinary tract infections, heart disease, depression, breast cancer, all of those things can come later on. So I like this slide because it really depicts, wow, during that perimenopausal time, that is really erratic, right? So when we're looking at treating patients symptomatically, our lifestyle interventions are sometimes aimed at improving those fluctuations.
Okay. So as my mother would say, I'm putting on my business out in the streets. So I would say I was in the early stages of menopause. I was premenopause pretty early. And, my claim to fame is I was like, but I was so young when I got my period. I do not know that that's even relevant, to be frank with you, because I was also 10 when I got my period, right? But then I would say it was around 35 I started noticing changes. It was around, I want to say, I haven't seen my last period. I think I saw the last one around around 46 as the last time. And I'm like, wow, that was really early. On the one hand, I was like, oh, great, I don't have to go shopping anymore. I don't have to buy the things. But then, other things showed up, right, in its place. And that's when, and I'm sure anyone will look at me today and say, shut up, Laura, because what I'm going to say is going to be annoying to a lot of people I know. I did notice that I started gaining weight in a different way. And yes, I do gain weight, for those of you out there listening and thinking about this. However, again, I know that I'm very fortunate and genetically predisposed to certain things when it comes to my body size and type. So all that being said, the point is that for someone who had gone through it, I considered to be early, to start having conversations with people, I recognized certain things showed up very, very early. And that's going to actually lead me into some of my other question is when exactly what are some of the symptoms when they start? What are we looking for to know, like, oh, is this, because it took me a while to realize what was happening. So what are the symptoms? What are some of the symptoms we might encounter?
Yeah, a lot of times it is just, a lot of people say, I just don't feel myself, you know, and I know it's very nonspecific, but that's how people feel. And that's, you know, it's hard to slap a diagnosis on that, right?
Right, pretty much.
Right. So, and the weight gain and a loss of resilience to stress. Sometimes their stress in life might not be higher than it ever was, but it feels higher. It's like their perception of it, you know, and their resilience to how they handle it. So there's a lot of things in the perimenopausal phase that we do to help with those symptoms, you know, helping out with the fluctuations in estrogen, which can definitely help. So, for instance, eating a healthy diet, high in fiber, can help level out those swings. Making sure that you're participating in some sort of stress management program, whatever that means to you, whether it's Reiki, whether it's yoga, whether it's walking in nature, anything like that. So that affects your cortisol, which will also affect your estrogen levels. Staying well hydrated, making sure you're optimizing sleep, not drinking too much alcohol, all of those things help, you know, level out those swings.
Yeah, now I'm taking a sip of water.
So you can
Please
feel.
continue.
Yeah. Yeah. So those are some of the lifestyle things. There's also some supplements that we use that help people detoxify their estrogen better or help with the balance of estrogen and progesterone, which helps them feel better too. And then when the time comes, hormone therapy can be beneficial for some people.
So what is hormone therapy? So we'll jump right
Yeah.
into that.
Okay. So yes, hormone therapy, the three hormones that we use during menopause are estrogen, progesterone, and testosterone. We use bioidentical hormones. So it means that they're identical to your own natural hormone. So it fits into the hormone receptor and functions just like your own hormones do.
And is it safe to get hormone therapy? Because there's also some ideas that getting hormone replacement therapy could be detrimental in the end. It might not be good for you. It's okay for a little while, but long term it may not be.
Yeah.
And so can you give us a little more information on that?
Absolutely.
Possibly?
So 20 years ago, there was a big study called the Women's Health Initiative that basically, without getting into too many details, it demonized hormones forever for
Okay.
patients. Now that we look back at it, we think, oh, it wasn't a great study. We can glean some information from it because it was a big study. But the population they used was older. So the
Okay.
average age was 63. Some women were 80.
Oh,
And they would
okay.
just be put on hormones at 80. So that could be 30 years after menopause.
Okay.
So it's not the practical use of when we would use menopausal hormone therapy, right? And they also didn't use bioidentical. They used some synthetics. So that's when the study was abruptly stopped due to the participants getting breast cancer, heart disease, and blood clots.
Okay.
There's been studies since that show if you use it in the right population, so the person around 40s, 50s, you know, during that transition time of menopause, and if you're using bioidenticals, there's actually good data that it's safe for most people. So breast cancer itself, while estrogen doesn't cause breast cancer, it can make certain types of breast cancer grow. So that is the one contraindication. So if you had an active breast cancer, you cannot be on hormones. So even if someone has a family history of breast cancer, we would just monitor them closely and make sure they're handling their estrogen well, but it's not a total contraindication like it used to be, because people are recognizing, wow, the benefits of this are so much greater than the risk of this. And a lot of the risk was over-embellished during that study. So,
Okay. So there's no concern for cancer right now, at least not that's been proven. Bone density improves, stays the same.
yes, usually bone density improves.
Okay. And okay, so that's like nice to hear, because I remember training people who asked about that, about they were trying to determine if they should go on hormone replacement therapy or not. Because having the same conversation with them, I heard that it's not going to be good for me if I take it, and then in the end, bone density is going to be an issue, and then I have to worry about cancer, and then I have to worry about all the things.
Right.
But that doesn't appear to be the case now. Is there a time frame? How, like, if I wait 10 years after menopause, is there a time frame as to when is there a window?
Yeah. So you get the most bang for your buck the earlier you start it. So the closer you are to that 1 year mark of not having your period, and even in perimenopause, it's okay to start that as well. The longer you wait, the more risk you might have for heart disease. So if you wait too long, you can already develop plaques and things like that. And some people who get estrogen way too late, who already have cardiovascular disease, it can make that cardiovascular disease unstable.
So does it matter that you have a health and fitness routine if you're that person, or does that just mean the possibilities out there regardless of what your lifestyle is?
So we would do an overall cardiovascular assessment, look at their advanced cholesterol panel, look at what their activity's been like, what their diet's been like. Do they have high blood pressure? Do they have diabetes? Other risk factors that contribute to cardiovascular disease. But I've known some people who are, older and want hormones for the benefit of bone health and brain health and all of this. If they're otherwise healthy, a lot of women do fine with it. But you do get the most bang for your buck for bone protection and all of the benefits the closer you do to the end of your period.
So this has all been pretty exciting. I want to dip into a couple of really personal questions that I feel like I want to ask and I need to ask. The first one being with regards to, one's regarding intimacy, and the other one is regarding odor and dryness. All right. So I've had a couple of people that I've spoken with who've come in and they've talked about what methods and things that people can use to go in and simulate collagen and work on dryness and the fact that things are getting smaller for lack of collagen and so on and so forth. So my question to you is, would the synthetic hormone, would it be able to help with that and help with the dryness, which, if I understand it correctly, when that happens, you're more prone to odor because everything, obviously the pH, everything's changing down there anyway in the landscape. But more importantly, if you're getting dry, is there a way to prevent the odor that comes that is a little more than your natural scent, is what I'm trying to say.
Sometimes vaginal estrogen, so bioidentical, it wouldn't be synthetic, can help. Can help with vaginal dryness and odor. So sometimes that can be, with lack of estrogen, there's also a change in your vaginal microbiome. So like the mix of good and bad bacteria. So it can be a perfect storm that can kind of cause those symptoms. So, but vaginal estrogen can definitely be helpful.
Okay.
Yeah.
And then intimacy, since we're in the neighborhood there.
Yeah.
So as time goes on, it can be more uncomfortable for women as they go, right? So is there anything that could be done about that? And what exactly is happening when, if and or when it happens? Does it happen to every woman? Let me start with that question. And as far as painful intercourse, to be exact, is that something that comes up quite often and with other women? With all women, excuse me, not other women.
Yeah, it absolutely does. So with lack of estrogen, the vaginal tissue gets very friable and thin and dry, So vaginal estrogen can be a game changer for that. And it's the type of thing that you take it once a day for a week, 2 weeks, and then you take it twice a week as like maintenance just to keep up with your moisture and things like that. But when it comes to intimacy, that is definitely a big problem. But also stress can be a huge problem, if you're not feeling connected to your partner or all of that. So that's why the holistic approach is very it helps so many things because we talk about your relationships. We,
Okay.
make sure that you're having stress management and you're, seeking counseling. Things change around this time, and we need to make sure that all parties are in the right brain space.
Okay. So then, we're coming around the corner here. We're starting to wrap things up. So I think my next question is going to be, you do accept insurance.
We do not.
You do not.
Yeah.
Okay. So, all right, tell me more. You don't accept insurance. So who's your clientele?
Yeah. So we unfortunately, a lot of the lab testing we do isn't covered by insurance. So that's
Okay.
why we just bundle it all into our pricing.
Mm-hmm.
Since the visits are pretty lengthy and comprehensive, that's why we're able to do it, because we don't accept insurance.
Mhm.
We do supply super bills for patients, so they can, if you have out of network benefits with your insurance,
Mm-hmm.
you can submit a super bill and potentially get reimbursed for some of that. It's
Okay.
not guaranteed, but it's something that some people do.
Mm-hmm.
And you can use your health savings account as well.
Okay.
So we have a lot of people tap into that for supplements, for our services,
Okay.
for all of that.
Okay.
Yeah.
And do you have packages, or is it just one set fee depending upon what the services that's being provided? How exactly does?
No, great question. So we have multiple packages depending on your need, whether it's weight loss, whether it's hormone therapy, whether it's functional medicine. And it depends on the level that we think we're going to need to see you and the level of testing that we do. For our general menopausal patients, like I said, we do the in-depth blood work. We also do salivary cortisol testing. But for our functional medicine patients, that are a little bit more complicated, we do gut microbiome testing. We do a lot of different things. We see people with IBS or a lot of gut issues that are really affecting their life. So that can be an example of one of our functional medicine patients that isn't hormone related.
And how do you test the cortisol? You said salivary cortisol. Did I say it properly?
Yes, you
Yeah.
did. So we do, the patient has to spit into a tube 4 times in the day.
Okay.
Because if you do just a spot check of your cortisol, a lot of times the morning cortisol is what you would normally get done at the lab via
Okay.
your blood.
Okay.
A lot of times it's normal.
Mm-hmm.
But when you look at the cortisol curve and what it should really look like, and then what yours looks like, it can kind of help explain a lot of things. For instance, the curve should go down,
Mm-hmm.
and then some people who don't sleep or have a lot of stress in the afternoon and evening, they go up at night. So there's different things that we can do and are like validating for patients. Oh, this is why I'm not sleeping. This is why I feel really stressed around this time. So how can we fine tune your management to, during that time, do some sort of activity that nurtures you or do something to take something off of your plate during that time,
Right. Right.
So it can really help fine tune the whole picture.
Okay. So my last question is, what's the last bit of advice that you would give to someone who might be going through these changes and transitions in life, and they're looking for answers and just cannot find them?
I would suggest that people find a provider that they trust and that listens to them. It's our feeling that all menopausal women should be given the decision of what things are going to look like if you take hormones, as well as are things going to look like if you don't take hormones, and what are the risks of both of those avenues, which is really important. So we've been steering women away for so many years,
Yeah.
and now thankfully it's becoming a little bit more mainstream. People are a little bit less fearful, but a lot of people also still aren't trained on how to do it. So that would be the next thing, is to make sure that your provider is familiar with hormone therapy and how to manage it.
Yeah, this is a conversation that I didn't expect to have with you, and I I'll be honest, recently, maybe in the last year, found out that there were these advancements in medicine that was even an option to me, because again, I come from an old school of thought, like, oh, no hormones, you don't do the replacement therapy because all these bad things are going to happen to you if you do. But I feel like I'm not probably the only woman. I don't think I'm that old. I know I'm not extremely young, but I don't think I'm that old either. And I'm sure I cannot be. I'm not the only woman feeling this way or thinking that. But this is information that I'm grateful for. It sounds beneficial to me. So much so I feel like I should look into it myself and see what that means for me and in any type of change it could make for me, because it's also what I'm finding is it's something that a lot of women do not talk about, I feel, with each other. I think it depends on what your relationship is, one person to another, honestly. Myself and my friends, we kind of sort of talk about it, but I find that we don't get too deep into the details until something comes up. And it just depends on what it is, what that something could be. So I hope this opens up dialogue for more people to discuss amongst themselves and with their loved ones if possible.
And a few weeks ago, they announced that the FDA is taking the black box warning off of hormones. I don't know if you've heard of this.
No,
but
I have.
So there was a black box warning, which basically means that there's risks to this. When you open the package, don't do it. You're going to get breast cancer. You're going to get a heart attack, stroke, all of the things, right?
Yes.
So that was based on that study. And now people have realized, oh, maybe we were wrong. Oops. So they're taking away that black box warning, which is great. So, because providers have been very fearful, as well as patients, of all of the hubbub with that study and how much it was publicized and really instilled fear in women. So it's great that things are turning in a favorable way for us. Yay.
Nancy, I think that's it for us. Any last thoughts you might have before we take off?
So.
Yeah. Nancy, thank you so much. This has been an amazing, amazing time with you today. Thank you. Ladies and gentlemen, mostly ladies, I'm guessing, I want to thank you for being with us today. And I would love to see you. I don't really see, of course, but I love to see you next time. Thank you so much for joining. I'm Laura. I'm your host. This is Bear Speak. Take care.